I think rehabilitation professionals, when it comes to war and conflict, they have a very challenging situation where they need to work with those patients.
Hello from the World Physiotherapy Congress 2025 in Tokyo. I'm broadcasting to you directly from Ginza here in the city center. And beside me I have Nihad Almasri from Jordania, and she has lots of stories to tell about physiotherapy in Jordania, especially under war conditions. So Nihad, what's going on in Jordania, and what do physiotherapists do actually?
Thank you so much. I'm a pediatric physical therapist and I practice in Jordan. I'm also teaching at the University of Jordan. So Jordan is one of the countries that received so many refugees in the last 2 decades. And because of that, we have to provide healthcare services, rehabilitation care for those people who are refugees in our country. The issue is that Jordan is a middle income country. So our public healthcare system cannot really provide enough rehabilitation care for those people. So what we ended up doing is having the model of NGOs, where a non-profit organization from all around the world coming to our country and start to work with the country to provide services for people who need it, who are affected by the war and by the conflict in their regions. Syrian, Palestinian, Libyans, Iraqis at certain time. That really easing the load on our public healthcare system. The emergency cases would go to the public hospitals and get care. Yet, if they need rehabilitation and assistive devices, they get this through the NGOs that get support from the government. Many of the students that we graduate yearly from the universities, they ended up working on these with the NGOs. It's very unique cases that they need to have certain set of competencies to be able to deal with them. So even in our education, our curriculum, we modified that to provide trauma education about providing physical therapy for people who are mentally affected by the war. And that's been such an amazing experience. I feel happy that we are contributing to the minimum to provide care for those people who really need it.
So I'm from a country where things are running very well. So the young physios in your country learn, or they are pushed into practice under war conditions.
Yeah, they are, and it's so hard for them, so tough. But I can tell you that they're young, so they were very open to learn. So at the level of the universities, we have conducted many projects, like Erasmus projects, for example, where the students will get special training from us as well as from other people from Europe who come and train them on how to deal with patients who are suffering from war trauma. That led to improving competencies as well as to opening a new venue for education, in that regard. So yes, it's a very hard situation for them, but at the same time, I think the support that we've given them, the capacity building we provided them, helped in that.
So it's very important to raise awareness for the situation in Jordania?
Yes, it's very important. I think rehabilitation professionals, when it comes to war and conflict, they have a very challenging situation where they need to work with those patients. They need to take care of themselves to be able to provide good care for those people. But this is the least that we can do.
Is there anything Germans can do to help you in Jordania?
Well, they are. I think many funding we get actually is coming from countries like Germany, like other countries who really think that they should contribute to that situation. I think what helps is networking, collaboration, opening venues for capacity building of people in land. And Jordan as a country is always open. We have our country open to anyone who would like to help and try to support us. And even themselves, they can even come and join us in providing care for those refugees.
Thank you, Nihad, for this very emotional insight. And to all of you watching this, thank you for experiencing the World Physiotherapy Congress 2025. Ciao and bye-bye.